Okay, so we will talk about the main types of hearing loss, the conductive hearing loss, the sensory neural hearing loss, and about the mix a little bit. We'll start with the conductive hearing loss, but first of all, let's look on a normal audiogram. We see here two ears in red, the right ear, in blue and X, the left ear, and we see that there are decibels, and there is a point when the patient just said that he heard the sound in that decibel. As we go down, it means that the patient needs more decibel in order to hear. Usually it is normal until 20 decibels. You can see right over here that this is the left ear. You can see that in every frequency that we tested, 20, 250, 500, 1000, and etc. In the left ear, in every frequency, it is less than 20 decibels, so it's normal. In the right ear, the same idea. So it's normal. Now, here we will look on conductive hearing loss, namely, there is something that doesn't let the sound wave travel throughout the external ear or middle ear. So the problems in conductive hearing loss is conduction, namely in the external ear or the middle ear. Think about it. In the external ear, what can you have? Earwax, for example. In the middle ear, what can you have? Tympanic membrane perforation, problem with the ossicular chain, fluids, otitis media, problem with the Eustachian tube. Everything that will cause damage in external or middle ear will cause conductive hearing loss. And in the audiogram, as you can see right over here, we tested the patient throughout the air conduction and throughout the bone conduction. Now, the definition for defining a hearing loss as conductive hearing loss is if there is a gap of at least 10 decibels between what the patient can hear throughout the bone and throughout the air. Now, throughout the bone, we give directly the sound through the bone to the cochlea. And through the air, we are going throughout the external ear and middle ear. So if there are problems in the external or middle ear, the air will be damaged, but the bone conduction won't, because bone go beyond the external and middle ear, doesn't go throughout them. It goes directly to the inner ear, to the cochlea. So this is an audiogram of conductive hearing loss with air-bone gap in each decibel of at least 10 decibels, air-bone gap. And usually in sensory neural hearing loss without any other problem, you will see tympanometry, which is type A. It means that the eardrum is working as expected and there are no fluids. So tympanometry can help you understand if the patient has conductive or sensory neural, if it good, if it fit, if it doesn't. So tympanometry type A, it means the eardrum works as expected, normally, compliance is good. And tympanometry type B and C tells you that B, there is no compliance, the tympanic membrane doesn't move. And C, there is a negative pressure. B can be, for example, with fluids behind the eardrums, serous media. And type C can be in, for example, Eustachian tube dysfunction. The Eustachian tube is closed, so there is no equalization of pressure. So there is a negative pressure in the middle ear, so tympanometry type C. So in conductive hearing loss, you expect to see type B or type C. In pure sensory neural hearing loss, you expect to see type A. Now in type A, there is AD and AS. AD is sometimes where the eardrum is too much vibrating, for example, ossicular chain discontinuity. And AS is when there is a little bit less movement of the tympanic membrane. It can happen, for example, in otosclerosis. Now, AS and AD sometimes can also be seen in quite normal patients, so correlate clinically. But those are the main types: A, B, and C. A, normal; B, no response; C, negative pressure. This is what you see, by the way. Here you can see the pressure in which there is the most compliance. Normally it's around 0. And in C, you can see it's usually less than minus 100, the compliance is negative, and in B there is no pressure, in which there is a max compliance. It's flat. What are the causes of conductive? Something that blocks your external ear, like earwax. Infection that can cause fluids and edema, like otitis media. The eardrum is ruptured. Cerotitis media is from the fluids. Ossicular damage, the ossicular chain, malleus, incus, and stapes doesn't propagate the sound wave expected. For example, if there are damage, discontinuity, rupture, broken. Trachea tube dysfunction, for example, upper respiratory tract infection, allergies, can cause edema in the trachea tube and closure of the trachea tube. Cholesteatoma in the middle ear will just destroy everything there, so it will cause conductive. And otosclerosis, when it is only in the around the oval window and not in the cochlea, it will dampen the stapes abilities, so again, conductive hearing loss. Now we move to sensory neural hearing loss. In sensory neural hearing loss, there is damage to the cochlea or to the retrocochlear part, for example, the nerve or something in the brain, and there is the problem, not in the middle or external ear, from the inner ear and beyond. Here you can see sensory neural hearing loss with a notch in 4000. It's very suspicious for noise-induced hearing loss, because this is exactly the area in which noise causes the most damage with this classic notch. But you can see that there is no air-bone gap of 10 or beyond. Quite close. Maybe I should have taken a better example with exactly bone with air, but until 10 is quite okay. Take 10 as your limit. So you can see that the bone quite goes with the air conduction without too much of a gap, without a gap then more than 10 decibels. There are some that define even 10 decibels as conductive, but okay, you got the idea. Now, what can cause sensory neural hearing loss? Everything that will cause damage to the cochlea, to the nerve, to the brain that relates to hearing, because the name suggests sensory, which means the cochlea, and neural, which means the vestibulocochlear nerve, the eighth cranial nerve, or the brain that relates to hearing. Sensory neural hearing loss, damage to sensory, cochlea, or neural, the nerve. What can cause it? Aging, noise-induced hearing loss, as we saw, ototoxicity, like drug like aminoglycosides, CPA tumor, especially vestibular schwannoma, but not just. Meningioma can also be there, granulomas and things like this. Meniere's disease that typically cause low-frequency sensory neural hearing loss. Now, Meniere's is special because usually sensory neural hearing loss tend to affect the high frequencies. It's more typical for sensory neural hearing loss to affect the high frequencies. Maybe it's because the base of the cochlea is much closer to the oval window, so it gets most of the energy, so it can be damaged. And the low frequencies are in the apex of the cochlea, so they get less energy, so less damage from noise. Anyway, sensory neural hearing loss most commonly damage the high frequencies. Meniere is quite unique in the sense that it causes damage which is sensory neural in the low frequencies. Now, conductive hearing loss more commonly damage the low frequency, but can do also a flat hearing loss with air-bone gap. Mixed can be caused by something that damages things in the external or middle ear and also the inner or the nerve. For example, temporal bone fractures can damage the ossicular chain, but can also cause otic capsule disruption, so it can damage the ossicular chain and the inner ear, so it can cause mixed hearing loss. Some genetic problems and otosclerosis sometimes can go beyond the oval window and into the cochlea, so it will damage the stapes, but also the cochlea, so it will cause mixed. And in mixed hearing loss, you can see that there is bone and air with air-bone gap that both are reduced. So this is a mixed hearing loss. Also, the bone is reduced and the air is reduced even beyond the bone. So this is a mixed hearing loss. And this is it about the main types of hearing loss and the basics about it. This is it, and thank you very much. If there are any mistakes or correction, please tell me. Please write in the comments. Leave comments if you can, and that's it.